It's probably moving from crisis to critical.
By 2025, they're expecting about 3 million Ontarians to not have a primary care provider.
That's shocking.
It's crazy.
People are suffering. They don't have family physicians. I hear this story every day.
I hope that this catches on a little bit with the government and they stop throwing money to things that don't work, because this works.
Erin, what is Polly?
Polly is an artificial intelligence that is able to produce statistically validated market research reports from social media. And she's the only AI in the world that can do that. So she works across social platforms, and then she listens to see what they're talking about and what they're saying.
What does Polly see around family doctor shortage in Ontario?
One of the things that really stood out for me is a conversation I saw across many social bubbles of people saying, substandard care has become the norm. Like, it's like we expect that we're going to go to the hospital and wait for 10 hours, or that we're going to wait 2 hours in a doctor's office to have a prescription filled, or just not have a doctor at all, and that it has become expected. And why do we think that that's acceptable? Why do we not expect better?
Mm-hmm. You mentioned that the frustration. So I'm curious, what other emotions do we get from Polly when we do talk about the family doctor shortage?
I would say the overwhelming part is sadness. It really is a story of human suffering. I want a family doctor and I can't get one. But there's also an issue of, because there's a shortage of doctors, you have to be happy with whoever you get. And sometimes that's not a great relationship. So we even find that people who have a doctor, maybe it's not a good fit with that doctor. And
But you don't want to break up with them, because then what
beggars
happens?
can't be choosers,
Yeah.
but it does affect, like, if you don't have a good relationship with your doctor, you might not be truthful with your doctor.
Beggars can't be choosers. 2.2 million Ontarians without a family doctor. It's a story that plays out in cities and towns across the province, just like this one. But how did we get here? Jayanne met with family doctor and researcher David Price to find out.
It's been a perfect storm. The pandemic, of course, hasn't helped any. As we're seeing burnout, we're seeing early retirements, we're seeing family doctors move to different areas of medicine.
Should we be surprised that we are where we are right now when we talk about 15% of Ontarians don't have access to a primary care physician?
If you think about what's happened in the hospital system, we've spent a lot of money buying new ORs, buying new equipment for the ORs, upgrading our ICUs, putting in new monitors, etc. We just haven't done that in primary care and family medicine. We're kind of stuck in the 1970s. And as a result, we haven't invested in the infrastructure to support family medicine and our primary care system, so it shouldn't be a surprise.
Students aren't selecting family medicine. Why not?
We're seeing a really marked downward trend when they look at their family physicians and think, my goodness, all the things that they're doing and the challenges that they're having. There aren't the resources to care for the patients with mental health and addictions. It's the amount of after-hours paperwork and forms to be filled. There's no time for personal leisure things and reinvigoration, and as a result, they burn out and they leave, and it just perpetuates the problem.
It's inevitable.
I think there's pockets that are equally bad in the urban areas that there are in the rural areas. But if you talk to any rural family physician or healthcare administrator leader, they will tell you that the shortage is particularly acute in the rural areas. There's a retention problem. There is a problem recruiting people to those areas.
In those communities, people are less likely to just see a doctor because it's too much trouble. And especially men. They're not going for those routine exams. And we see them saying that online. It's just too much trouble.
It's really upsetting to hear that someone would consider their health being too much trouble. But if you don't have access to a doctor, what are your options?
I basically just got a letter.
So you haven't had a family doctor 3 years now?
About 2 or 3 years.
So what do you do if you need to see a doctor?
Most of the time I don't. There are walk-in clinics. Because of how busy I am, I can't really afford to be waiting for 2, 3, 6, 8 hours at a time to get something looked at. So a lot of the time I just have to tough it out and deal with it. The last time I went, I think it was 5 or 6 hours I was waiting. Little piece of metal bounced up under safety glasses and sitting there for hours waiting for somebody to have a look and just swipe it out with a Q-tip.
So what would happen if you were to miss work because you were sick?
That would be disastrous.
Yeah.
It fills up fairly quickly on Monday. That's usually the way it goes. I empty the parking lot out by Friday and it's filled back up on Monday. I opened the shop back in June of 2015. I got 2 people working for me and we stay busy all year. We have no shortage of work to do.
Have you ever thought about moving, like being forced to move because in order to get healthcare?
It hasn't really crossed my mind. I like living in a rural area. I like...
This is where your community is?
I've got family that goes back 6 generations here. I've got a lot of roots here. Rural areas, there are always concessions made when you're moving to a rural area, whether it's movies or medicine. There's not as much access out here, but most of the time I don't need it, luckily.
It shouldn't be that way, luckily, right? You shouldn't
Yeah.
be like, fingers crossed.
I am glad, but
Yeah.
but it would be nice to know that if it was more severe, that I would have access to what it was needed.
It's a heavy burden to care for people when you think they're not getting everything they need in a timely manner, and you're also feeling that with them.
I imagine it must be a struggle because you are in this business to help people, to take care of people, and then to have to say, no, I can't. It must weigh on you.
I tend to usually have patients a couple times a week asking very politely if, can I take on a family member? Can I take on a friend of a friend who's moved to town? It really does play at your heartstrings because it's not only do you really want to, but you know that you're always somewhat compromising. If you take on more patients, am I taking on too many that you can actually provide the care you want to? And yet if they don't have that person to be their primary caregiver, that creates a big deficit for them in their healthcare. There's 2 positions that are currently open. One, unfortunately, has been vacant for about almost 3 years now.
How many patients do you think currently don't have a doctor here?
So the present sort of census on it is that between 100 and 200 patients right now in the municipality of Marmora. So that's more in just this little locality of 4,000. We do end up being sort of the only family physicians in a greater area. So that number actually swells quite quickly to closer to 1,000.
We have a very large population of seniors here. We have a long-term care home here, a retirement home, plus a nursing home. So those residents are particularly affected by needing a doctor on a regular basis. I'd like to see young families be confident here that they can live here, get the services, the medical services that they need here. And I just think it's important for the health and well-being of our residents to have access to good medical care.
What would you say is the biggest challenge in attracting a doctor to come here?
Right now, it's really a national problem or a provincial problem. Everybody is short. We offer them $100,000 over 5 years. We offer them a free apartment. We have 2 apartments in our medical center. We pay for cleaning services. Basically, a doctor could move in there almost cost-free. We think that it's an excellent incentive package. And in addition to that, Hastings County, they also have an incentive package of $100,000. And I understand that the province offers a further incentive that I believe is about $80,000.
It's a lot of money on the table,
It is.
especially if you have student loans. Why do you think not many people are biting?
Places like Belleville, where they have a large hospital, have just recently hired their own recruiter just to deal strictly with doctor recruitment. We don't have that kind of resource here. I don't know that there's anything specific that we can ask the province that hasn't been asked by every other municipality. I guess we just hope for fairness, that we aren't ignored in our needs here. in the city, you have options to get on a train or get on a bus to go to your doctor or whatever. It's more important here for them to be local because we don't have transportation services. So I would really like the province, in considering doctor distribution, if you will, to consider our unique needs in every other small municipality.
My brother lives in Calgary. He comes and visits, and he calls it God's country.
God's country, yeah. It's very peaceful.
I kind of got spoiled when I was young. We had a doctor in town, Dr. Parkin, who was, I don't know when he wasn't open, and he delivered 3 of my children, and like he was always there. And then he retired, and it seemed to be difficult to find, you know. But I'm getting older now, and it would certainly be a lot easier to relax knowing that I don't have to go through all kinds of troubles just to get somebody to take an X-ray of something, you know. So
help me understand that a bit better. If you were not feeling well, what would you do?
there's 2 pharmacies in town, and the one we go to, she's been very good at trying to fill that gap as much as she can, and so there is a virtual clinic there, and we've used that. It's better than nothing, but not a lot better than nothing. We'd like to think we could have better service. If you read about it, and I tend not to because it can scare you a bit about what other things can come up. I don't have a doctor that I can sort of say, could you check this for me, you know?
Yeah, Dr. Google's not our friend.
No.
Go down that rabbit hole.
Yeah.
Have you thought about maybe leaving the community that you love to be able to access better health care?
I'd like to think that this is where I'll be, you know. So it's tough. I guess they're working on it, but I don't know. It can seem like a long time for change.
If we accept you today to start medical school, by the time you're actually out in practice, it's anywhere from 7 to 10 years. And that's a long time. And so the government needs to be committed to making changes to our system now to start to address the needs that we have in 2023, as opposed to hoping that we'll solve this problem in 2030.
We have currently about 13,000 internationally trained doctors on the sidelines. What can we be doing to sort of get them into the workforce?
One of the solutions that has been bounced around is a more rigorous evaluation program. Are you ready to practice in Canada today, tomorrow? Do you need extra training to understand the system, the referral patterns, et cetera? Is that going to be 6 months or a year, or do we need to train you for a different role? I think there's no question that many of us feel that this is an untapped resource.
That's the number one thing people are saying. Why do we have doctors driving cabs? That in other provinces, they recognize foreign credentials more easily. And we're seeing people say, maybe we need a federally regulated system for approving doctors in Canada so they can move around and so we can get foreign trained professionals more easily, because it doesn't seem to be working here.
Why did you want to become a doctor?
It's really because it gives me a lot of purpose to be able to help people. When I actually started practicing, so outside of medical school, working in the oncology department, seeing people beat cancer, it's a really rewarding thing to be able to have that ability to touch lives and actually have a positive impact on society. There's nothing better than that. There's no feeling. My mom's a Canadian citizen, so I actually became a permanent resident at the end of my first year of medical school. And so the decision was complete medical school, because it's hard to get in medical school anywhere in the world. And then I would do my Canadian exams, and then I would work here. That was kind of the plan.
How has that worked so far?
Not great. In Canada, there's just not enough spots for internationally trained physicians. And so it's much more than passing the examinations, which I have done and so many other international physicians have done, and just no opportunities to actually go any further.
How would you describe that feeling when you had that realization that you wouldn't be able to pursue something that you spent so much time wanting to do?
It felt like a gut punch, honestly, and it really led to a decision of either staying in Canada and giving up my dream of being a doctor and all the hard work that got me to this point versus traveling back and forth between Jamaica and Canada to both like keep my medical license practice up and also like still remain a permanent resident, be able to have a relationship with my mom, etc. So yeah, that was pretty hard and still is hard. I'm my mom's only child, and so we're super close. My mom's the one who's made all of this possible. For her to make all those sacrifices, for it to kind of feel like it was for nothing, like I can't do that. I mean, when you think about having immigration pathways that literally give you points for being an internationally trained physician and then coming here to give that up, it's a really hard thing. It really is a decision now is, am I going to stay in Canada and give up my dreams of being a doctor, or am I going to move somewhere else?
What are the options of where you could move?
So options right now, honestly, are trying to go to another provinces where they have better policies for internationally trained physicians. Yes, it's not perfect, but it's better than what Ontario currently has. Or go somewhere else like the UK where, you know, you do your exams, you get to work. A straightforward kind of system.
The town that we went to, Marmora, the mayor has a nice package to incentivize family doctors to come because they're having trouble recruiting doctors to come live there. And they're offering a lot of money and they're offering accommodation, but no one is coming there. If you had the opportunity to, would you live in a town like Marmora that needs a primary care physician?
Of course. It's the opportunity to do what I love. It's the opportunity to help people. It's the opportunity to make a difference. I would. And I know that would be the answer for the majority of internationally trained physicians as well.
So there's a lot of places like that in this province, in Northern Ontario. The stories that you hear just make you want to, okay, we've identified the problem. We've identified the solutions. So why can't we merge those two things together?
People are suffering. They don't have family physicians. I hear this story every day. And there's so many of us that have the clinical skills and knowledge to actually help to bridge this gap. Do I think that incorporating internationally trained physicians is the only solution to the healthcare crisis? No, but it's definitely one of the solutions.
Nurse practitioners, physician assistants, dietitians, social workers, system navigators, all have a role within the system. Having that interprofessional team allows for a more holistic, specific kind of care for individuals. But no matter how you look at it, only 30% of Ontarians have access to any sort of interprofessional team. There is not a one-size-fits-all for this. It's got to be community-driven, understanding the context of your own community. But just plopping another doctor in there or just plopping another nurse in there or another pharmacist isn't going to work. How do we integrate and coordinate the care?
They're hoping that some of this money that has been announced by the federal government, that it will be dedicated to community care. For the majority of people, that's where they access healthcare on a regular basis. And so these are your physiotherapists, your social workers, your pharmacists. How do we get more access to professionals like that?
Because right now, everything seems to be referral through your family doctor.
Everything is, and we're seeing a lot of complaints about that, either A, because I don't have a family doctor, or B, my family doctor is like a gatekeeper and doesn't think I need these things. We saw a lot of people saying, is there a role here for nurse practitioners? There's registered nurses and nurse practitioners, but how do we see them manifest differently in the community? I know they get different training, and I think a nurse practitioner is closer to a family doctor, and yet I don't see nurse practitioner offices where I can go and get tests done.
They do exist, but only 25 dotted across the province. I visited one in Kitchener.
I've only recently, and it's bizarre because I've been on this planet for 4 decades, I've only recently learned about nurse practitioner clinics. Can you tell us how they work?
Yeah, so nurse practitioner-led clinics were created about 12 to 15 years ago, and they're a team-based model of primary care. So we do things a little bit differently than your typical family practice in that nurse practitioners are the lead. We are the ones who see the patients are assigned to our care. But at the same time, we also have a very supportive team around us. So we have social workers, we have registered practical nurses, we have our administrative team, we have a pharmacist, all working together to provide patients with the best patient outcomes. We really get to know our patients and kind of take us that nursing lens to primary care and looking at all their problems, not just their physical, not just their mental, but their social problems, their housing issues, and how that all interplays and relates to their overall health.
Our satisfaction rate is always well above 96, 97%. And I think that's constantly the feedback we get, is that it's kind of, all of the services that they need are here, that they feel heard, that they feel welcome, that they feel accepted, and making sure that people get what they need. It's not always about everybody getting the same thing, because not all of us need the same thing. That clients and patients are able to get to the clinic, and if that means getting them a bus ticket, if that means connecting them to a health guide to get there, and not everyone needs that. But I think that everyone, despite socioeconomic status or where you live or whether you even have a home, should ever impact your accessibility or your access to primary health care.
My understanding is that this area is one of the areas in the province that has a severe family doctor shortage.
Last time I heard it was about 50,000 patients. There was hardly any primary care physicians in the area, and a couple were retiring, which left thousands of families without primary care.
I had a nursing friend that told me, go see the doctor. She looked at my eyes, and my eyes were yellow, right?
And she's like, there's something happening.
Yeah, there's something happening. And I tried to get into the doctor. They said it would be 2 weeks. She called me back and said, did you see the doctor? I said, no. She said, go to the nursing clinic. I phoned. They told me to fill out a sheet online, then come and see him. 20 minutes later, I'm on the table. I had jaundice, which I didn't know I had. That was how quickly they looked after me. Up to that point, if I'd have waited another 2 weeks, I don't know what would have happened to me. I live in an adult-only building, and one of the biggest problems that you hear about is I can't see the doctor.
Can you help us understand what nurse practitioners do? What's the difference between a registered nurse, a nurse practitioner, doctor?
Yeah, so a registered nurse is a 4-year Bachelor of Science program through a university and sometimes college. A nurse practitioner has to work as a registered nurse for at least 2 years of full-time practice before they go back and get a master's degree in advanced nursing practice or a nurse practitioner degree. All right, so I'm just going to check some of your reflexes. Nice and relaxed. And with that, that's where they get that extra training on assessment and diagnosis, prescribe medications, treat ailments, order tests, refer to specialists, and really parallel the care that would be seen in a typical family practice.
They always have a connection with the doctor. I have a doctor that if Krista, who's my practitioner, needs a doctor, then Dr. Parker calls me. I would go see her, whatever, right? So they also hook me up with a dietitian. She works in conjunction with the nurse practitioners and makes sure every 3 months that I'm eating the right food, that I do my blood sugar stuff, and then it's good. She gives me a chart to fill out.
How do you think Ontarians would be impacted if they had more access to nurse practitioner clinics?
Oh, it would be such a huge benefit, especially in like rural areas that are really struggling to get providers to get there. We know by 2025, they're expecting about 3 million Ontarians to not have a primary care provider.
That's shocking.
It's crazy. And the nurse practitioner profession is the fastest growing healthcare profession in Ontario since about 2005 or so. So a lot of nurses are making that upgrade, taking that extra schooling, that extra master's degree to become nurse practitioners. And there's so much opportunity for the Ontario healthcare system to then optimize that nurse practitioner role and fill those gaps with it. I think one of the big things is we need more seats. We need more seats for nurse practitioners in our programs. So for the university programs, the cap has not changed for the seats available for RNs to become nurse practitioners. So only so many can be accepted to a program each semester.
Even if more people want to go into it?
There's only so many seats, right? And so there's lots of people that are willing and wanting to advance their education and fill those gaps in another way as being a nurse practitioner, that there's not enough space. By having comprehensive primary care in clinics like the nurse practitioner-led clinic, we're known to decrease the amount of patients that go to emergency rooms. We decrease the amount of patients that are being admitted and being able to manage more people in the community and in their homes overall relieves the entire healthcare system.
Does it give you peace of mind to have access to that care?
Oh, heck yeah. I hope that this catches on a little bit with the government and they stop throwing money to things that don't work, because this works.
So from the patient point of view, it's very clear that we're living longer. We're living with more complex diseases and multimorbidity. So Dr. Barbara Starfield, an American researcher, has demonstrated over and over and over again that the health of a population is dependent on the health of the primary healthcare system. And that study has been replicated in pretty much every single country around the world. So we know that unless we have a robust, strong primary healthcare system, we are going to fail our population. And every single study has shown if we can get upstream in the care of our population, we do way better downstream, and it's less costly. There's less morbidity, there's longer life, there's more quality of life. And so investing in our primary healthcare systems and our primary care systems is got to be the take-home message here.
So, my takeaway? Investment doesn't have to just be more money. Double down on healthcare teams. Remove barriers for those ready to help. Listen to communities, let them stay together. It's our health. We can't keep failing each other.